Hello, I'm Dr. Robert Adams from Adams Chiropractic Technology Group in Sonoma, California. I want to take a few minutes to talk about what is a chiropractic adjustment. A chiropractic adjustment is a specific movement of a joint that's lost its appropriate relationship with the joint above or below it. We often call that a spinal subluxation. Luxation means dislocation. So if it's a subluxation, it's less than completely dislocated. And when a spine isn't moving properly, or a joint, in this case let's talk about a cervical spine joint, isn't moving properly, we would call that's one element of the subluxation complex, so aberrant motion. Over time, since the joint's not moving properly, it can get inflamed. That's another component, inflammation, irritation of the soft tissues. And then since the joints aren't moving, over time the muscle tissue begins to weaken. That's another component, weakness and discoordinated motions. And then of course pain can be a problem. If it's dysfunctional for a lengthy period of time, we'll start to see some aspects of spinal decay, or what we can call degenerative joint disease or subluxation degeneration. Lots of terms describe the deterioration of a spine that's not moving. But any joint that doesn't move properly, whether it be a finger joint, a thumb joint, elbow, shoulder, or spinal joint, will deteriorate. They're all the same class of joint. They're diarthrodial joints. A joint that doesn't move degenerates. The difference between spinal joints and most of the joints of your body are that you have voluntary control of your elbow joint and your finger joint, because there's a signal from a part of your brain called the cerebral cortex, motor strip, specifically to those extremities. There is no direct pathway from your motor strip to the individual deep spinal muscles. They're controlled reflexively through a part of the brain called the cerebellum, which reflexively controls those deep postural back muscles. And that's why if a person has a lack of motion of a spinal joint, somebody needs to get it back in motion. It won't spontaneously move again. And physical therapy alone won't bring the individual joint back to motion, because as you start to exercise the whole spine, the areas above or below that fixated joint will move more to compensate for the weakened area. And actually, certain exercises can actually be more damaging to the spine because of that. So what chiropractors want to find is the area of the joint or area of the spine that is not moving properly, and then adjust it. So a spinal adjustment is taking that joint and getting it back in motion. And there's different ways of performing that activity. One is with a hand adjustment, and that's what most chiropractors do. But we also can use instruments. There's various adjusting instruments that can be engaged in the process, all of which the design is to restore intrinsic movement of the individual joint. But what does an adjustment do? Well, a spinal adjustment has wonderful benefits. One, it activates movement receptors. When it stimulates mechanoreceptors, there's a benefit to that. One, mechanoreceptor activation causes feedback from the touch receptors or movement receptors deep in the spine to this area of the cerebellum to reestablish a reflex movement between joint motion receptors to the cerebellum to the muscles, which cause more movement, which cause more feedback, which cause more movement, which cause more feedback. So it jump starts that mechanism, improving the coordinated movements of postural spinal muscles. The other thing an adjustment does when it stimulates mechanoreceptors is it activates those mechanoreceptor pathways which go up to the brain to inhibit pain. So when the brain functions at a higher level, it activates descending inhibitory pain pathways which inhibit pain. Also, at the spinal cord level, there's inhibition of pain as a consequence to touch receptors. You ever notice how when you hurt yourself, like you hurt your thumb, you might want to squeeze it and it actually feels better? Or you hurt a leg muscle, you might tap it or something? That's why it feels better, because you inhibit your own pain by activating your own movement receptors. Well, adjustments work that way with respect to spinal joints. The other benefit of spinal adjustments is improves autonomic tone, or better control of the automatic or autonomic nervous system through various reflex pathways at the spinal cord, particularly an area of the spinal cord called the intermediolateral cell column. So a spinal adjustment activates pathways which flow through those areas. The other beautiful thing about chiropractic adjustments, when they stimulate movement receptors, is they activate pathways that go up to the brain, up through the brainstem, up into an area of the brain called the thalamus. The thalamus is where all of the sensory information from your vision, hearing, taste, temperature, pain go through that area. And so by increasing thalamic activation, you actually improve the primary perceptual experiences of vision, hearing, taste, and temperature. So many people will comment and note that after adjustments, they actually do see better and actually hear better. And there's a neurological understanding for those benefits. So the mechanoreceptor activation improves health by improving coordinated movement of the spine through cerebellar reflex pathways, inhibition of pain, both presynaptic and postsynaptic through the cord reflexes, as well as descending brain inhibitory pathways. It improves autonomic tone of the area through the reflex pathways in the spinal cord, and it improves primary perceptual experiences of vision and hearing and smell through various pathways through increasing cortical activity. In our office, we adjust primarily with our hands. We'll do some instrument adjusting, but just give you an example of some of the ways that we adjust the spine. Let's move to some adjusting tables. This is an example of a toggle recoil, and we determined this is the atlas, the first cervical vertebra, atlas, and then the axis, the number 2 vertebra, cervical 3, 4, 5, 6, 7. But to do the atlas, we use a specific technique called a toggle recoil, or this is the Palmer specific technique. This headpiece, this table drops, so we would do an adjustment by taking and placing our hand that we've determined from the Nasion X-ray. So if you look at an X-ray, a specific projection which allows us to determine whether the atlas has gone to the right or to the left. We put our hand on the atlas. Say, for example, this would be the right side of the neck. So we have the patient lying on their left side. We put a contact on there. We're going to push just enough for that table to drop. So an atlas adjustment would look something like that. Very fast with the hands. And the headpiece and neck fall together. The headpiece stops, the head stops, and the neck makes a quick little movement which would release the subluxation pattern at this area right under the skull, the atlas. It's a nice clean adjustment, very, very gentle for children, and it's like I said, it's a very light and fast motion, but it's a momentum that creates that change. Adjusting the lower cervical spine, we most often will have the patient lying on their back, face up, and we've determined which part of the cervical area needs an adjustment, and we'll do what's called a coupled adjustment. So we create a tilt and a rotation of the joints. We'll make a contact on the spinous and laminar area and make a very light and fast movement, just like that. So we create elongation, at the same time we create a movement which causes the vertebra to tilt and rotate at the same time in a coupled fashion. So a common condition is low back pain, and so we'll adjust the low back often with a side posture adjustment. In this case, we lay the patient on their right side. We make a contact with our fingers. We're holding the spinous and finger in the laminar junction. Forearm would go on the iliac area, stabilize the patient's spine, and we do a very quick movement like so, which is going to create movement around these various facet joints in the spine. Again, activating movement receptors and also fast stretching the muscles around there to cause a reflex feedback through the cerebellum to allow better control of those postural back muscles. We may also adjust this pelvis with some blocks, sacrooccipital blocks. For example, if we wanted to rotate this hip, we put one block high, we can put another block low, and let gravity create a rotation of this hip going forward and this hip going backwards. We may even augment that with putting a little bit of a pressure in there to create some movement around that axis of rotation for a sacroiliac joint. We may also have a patient lie on their back. In this case, the ilium would have rotated backwards on the right and forward. So we put the block low on one side and then higher on the other side, and again allow gravity to create the rotation of the hip around the sacrum. So those are a couple of common techniques for adjusting the low back area.